Hello, and welcome to this MiniGEM on a focused assessment following a fall on the ward. I'm Dr. Peter Brock. Now, we've chosen this topic because we've been approached by junior doctors who have said to us that they've been asked to see patients after a fall and haven't been clear about what assessments they should make. So hopefully by the end of this presentation, you'll be able to describe the steps involved in assessing a patient after a fall and identify the patients that need immediate investigation and treatment. Now, clearly, this is a common scenario and an assessment often performed by the most junior member of the medical team. But if you think in A&E how many different pathologies and patients present with their presenting complaint as a fall and how much pathology can come from that, it's clearly something that can result in serious morbidity. So how do you initially approach the patient? Well, consider it like a mini trauma and follow an ABCD pathway. Now, because it's a mini trauma, you've also got to consider the patient's C-spine, but you can be practical with who you assess for this. If they've got a head injury with pain, paresthesia, or an immediate fall in their GCS, then you need to consider that they could have sustained a C-spine injury. If this is the case, immobilize them, palpate their C-spine, and if you have any concerns, order an X-ray, keep them immobilized, and ask for help if you feel you need it. In terms of the rest of the assessment, don't neglect your breathing and circulation investigations and examination, because it's there where you might pick up the underlying pathology that's actually caused this fall. And finally, when it comes on to assessing their disability, try to record the eye, voice, and motor parts of the GCS separately, so it's easier for someone to interpret if these have changed when they come to reassess the patient later on. Obviously, you're going to talk to the patient themselves and take a bit of a history. Your main focus on the history needs to be for red flag symptoms of a serious head injury. For example, loss of consciousness, amnesia, vomiting, and any new focal neurology. It's also worth talking to the patient about the nature of the fall and how they felt beforehand, including any pre-syncopal symptoms or any chest pain and palpitations. That's because this might guide you towards what immediate investigations you can do and what immediate treatment you can start. You're also going to want to speak to your staff on the ward. They may have witnessed the fall itself, and once again, they may be able to pick up on those red flag signs for you. They might have seen some loss of consciousness, noticed some amnesia or vomiting, or picked up on some new focal neurology itself. In addition, you're going to want to take a look at the medical notes and the patient's drug history, because this might give you a clue as to what's contributing towards the fall itself. With all this in mind, you can then commit to some further examination of the patient. You should all be familiar with the neurological exam, but you're also going to want to take a close look at the head if you fear they have sustained a head injury. In particular, look for bruising behind the ears and around the eyes, and any fluid or blood that's leaking from the nose. You're also going to want to consider have they injured any of the bones in their body. Examine and palpate anything that they've had an impact onto and pay particular attention to those high-risk areas, such as the hips and pelvis or any of the limb bones. Now, who you're going to let go back to bed and sleep and who you're going to require immediate investigation of. Well, if they've got any cardiac or syncopal symptoms, then it's worth getting an ECG straight away. An MI or serious arrhythmia could initially present as a fall. If you've got any suspicion of fractures, then do an X-ray straight away. The patient whose hip fracture is picked up straight away will have a better outcome than that is delayed. Now, when it comes to head injuries, there are guidelines published by NICE for who should get a CT head straight away, and we'll go into this in later slides. Finally, if you pick up any other underlying pathology, then start your imaging and bloods straight away. So who do we need to contact the radiologist for immediately? Who needs that CT head within 1 hour? Well, the list is here, taken from the NICE guidelines, and I'm not going to go through it step by step. Simply advise that you take a photo of the slide and carry it with you on your phone, perhaps, so you've got a point of reference for when you're on the ward. Of note, there is also a group who need a CT head within 8 hours of the injury, and with on-call shifts being up to 12, 13 hours, that may mean that you still have to consider calling the radiologist. Of interest is this includes a group of people who are aged over 65 and have had loss of consciousness or any amnesia following the fall. The over 65 population is obviously the group that's going to have an increased risk of falls, so it's important to bear this in mind when you're considering who needs a CT head during your shift. Obviously, you're going to commence immediate management with these patients and to consider whether they need any analgesia, whether they need any of their wounds dressing or suturing, and treat any underlying pathology that you may have come across. You're also going to consider if they need any monitoring. Now, when we write neuro-obs in the notes, what we should ideally be writing is a guide that's written here. So if the GCS is less than their baseline, they need neuro-obs every 30 minutes. And then once the GCS is at the baseline, it should be done half hourly for 2 hours, then 1 hourly for 4 hours, then 2 hourly thereafter. Try and record this exact plan in the notes and communicate it to the nursing staff. Speaking of medical records, try and record as much as you can about the fall and the nature of the fall when you're assessing the patient. That way that the patient's regular doctors will have a better chance of preventing these falls happening in the future and dealing with the consequences. In particular, you need to communicate your plan with the nursing staff. So what should be our takeaway points from the session today? Well, follow your ABCD as part of your initial assessment of the patient. Try and record the fall's history, even at night, and the cardiac symptoms, fractures, and head injuries may require immediate investigation. Hopefully, you now feel comfortable describing the steps involved in assessing a patient after a fall, and you can identify those patients that may need immediate investigation and treatment. If you want to read around this subject a little bit, then the NICE guidelines for head injury are particularly useful for those who may consider doing a CT head-on. And if you want to get an idea of what steps can be taken and what the evidence base is behind this to prevent further falls, then check out either these NICE guidelines or some information from the Cochrane Library. Thank you very much for listening.